So right here is actually one of the precautions that probably people would take, where you don't want how will I put it, like samples to actually get contaminated, and the rest of it. You just want everything to be neat in the radiology department. So what are the precautions that you can actually follow and ensure that this level of neatness is met? Okay, so contamination in radiology, of course, trying to look at it and trying to control it is very, very essential. It's very essential because you don't want infections to get to staffs. You don't want new infections to get to patients, or infection to be spread from one patient to another. So first, let's talk about the sources of these contaminations. We'll look at the sources of this contamination, then of course we can now be able to look at how this can be controlled. So we have the patient contact surfaces, like all these X-ray tables, CT, MRI gantries, ultrasound probes. They are all sources. Then we also have the reusable aids, so some things that you can use it on this patient, use it on another patient. If you don't clean it properly, when you use it on the first patient, you can push the infections there. Hands of staffs, airborne particles, contrast media, and also injectors. So how can you be able to control infections in such areas? So first of all is hand hygiene, okay? Because it's your hand that is touching a lot of places, and it's always nice to keep your hands very neat. So you always wash your hand, and you can also be using all those gloves on your hand so that you prevent spreading infections from one place to another. The personal protective equipment, that's where you now use things to masks, gloves, your eye protection, everything, Then equipment cleaning and disinfection is most of the times when you use particular equipment for a patient, you want to actually clean that. So when you clean it, ensures that the next patient is safe too. So you also use other disinfectants, okay, that are compatible with the surface you are using on, Then environmental controls, all those adequate ventilation in imaging rooms, isolation protocols if you are feeling like the infection is actually high up there. So safe handling of contrast media and injectors. Most of those contrast medias, for you to get them to a patient, you have to actually inject it through the veins. So you don't want to actually drive infections right in there. You want to be safe. The patient flow management is schedule infectious patients at some specific times that that probably other people are not there, so that you reduce the spread of such infections.